We are Teachers College, the first and biggest school of education in the nation. Here, in a single square block in the heart of New York City, we have invented and reinvented the modern K-12 classroom and the community school. We've launched and reshaped so many fields of inquiry in education, health, psychology, policy, and leadership. And today, we're shaping the future in racial literacy, education in human sexuality, nutrition policy, community health, global mental health, and emotional and psychological resilience. From generation to generation, our faculty, students, and graduates have tackled society's most pressing challenges and improved the lives of the people and communities we've served. Think of us as an incubator and accelerator for creating a better world. So tune in to Teachers College, the premier address for informed conversations about how to create a healthier, better educated, more equitable, and more just world. No matter where you are, you're right in our neighborhood.
Good afternoon, everybody. My name is Basil Smykel. I'm an adjunct professor here at Teachers College, and I wanted to welcome all of you to the Teachers College Come Together series, addressing the agenda, education and public health in the new administration. We have a really exciting discussion prepared for you today, broken down into two parts. We're going to talk a bit about early education policy, K-12 and higher education. We're also going to talk about public health policy. But first, I want to introduce our panelists for our conversation in education policy, early childhood, K-12, and higher education. Our first panelist is Professor Jeffrey Hennig. Jeff is a professor of political science and education at Teachers College. Jeff, it's good to see you. Welcome.
Hi, glad to be here.
Thank you. Professor Lynn Kagan, Virginia and Leonard Max Professor of Early Childhood Education and Family Policy, and the co-director of the National Center for Children and Families. Welcome, Professor Kagan. And finally, for this panel, Professor Judith Scott Clayton, Associate Professor of Economics and Education at Teachers College. Welcome, all of you. It's good to see you, and we have a robust conversation ahead of us. I must say that before we begin and before I toss my first question out to the panel, there is an opportunity for audience questions, which we will take after this discussion. And we'll look forward to those questions as well. So please make sure to put them in the chat. Professor Hennig, my first question is to you, sir. Given the dynamics of the 2020 presidential campaign, the new administration, the Biden-Harris administration, may have a large reservoir of political capital to promote substantial changes in education policy. Considering the limited role of the federal government relative to state and local policymaking, what are the potential options for Biden in this first year of his presidency?
Sure. Well, it's true that presidents often have a relatively short honeymoon period when they have a chance to move legislative action that is tougher later in their administrations. And I think it's also true that the pandemic and the sense of crisis around that and the school impacts, including closings, probably also create a kind of a reservoir of demand and expectation that there'll be something big and dramatic coming out of the administration. So it's tempting to recommend going out and doing something, really big and impressive and really getting in and reforming education in this opportunity. I'm going to argue for something that's a different approach. And that's partly because, as you said, the federal government is structurally limited. It's limited by law, it's limited by finance, it's limited by politics and how much it can do directly on K-12 education. It's limited by law because under the Constitution, education is considered a reserved power held to states. It's limited in terms of money because the federal government provides less than 10 cents on the dollar. There's a limit to how much you can leverage that money in terms of enticing states and localities to bring about change. And it's limited by politics because of strong loyalty that state and local officials and families and citizens have towards a tradition of localism that often prompts resentment and sometimes backlash when Washington, D.C. gets too aggressive. So rather than dramatic, new, and direct efforts focused on changing schools and teaching, I'd recommend that the administration try to build on some well-accepted roles for federal leadership. And rather than draw political capital for school-specific initiatives, I'd recommend focusing on some non-school initiatives, things that don't run through the Department of Education, that may pay bigger dividends for education than the school-specific ones. So let me briefly mention four. First, don't underestimate the power of the bully pulpit. I think the country needs, and President Biden can provide, a broad vision about why it's important to have a strong public education system and why it's important to recruit and retain good teachers and to address equity broadly defined. Second, data collection is something the federal government has done for over 100 years. I think it's important to shift from the use of data that was prominent under the last three administrations, really, which is data for accountability, data for testing and holding schools and districts accountable, to what I call data for democratic accountability. Data that moves beyond standardized test scores to involve a wider range of indicators that could be useful to citizens and to advocates battling for education at the school and community levels. That's things like information on family and neighborhood conditions that relate to school readiness, data that looks deeper into parent engagement practices, data that can shed light on race, ethnicity, and gender-based inequalities. Third, the federal government can and should put a heavier finger on the school finance scales. This is something that's we've done since the mid-'60s. I hope the Biden administration will, as it said it will, make Title I funding larger, make it also more redistributed, more focused on higher need students and communities with a lot of higher need students and students with English language learners, students who need support services and the like. And fourth, and this is where I'll end for now, but I think it may actually be the most important. It's a little bit counterintuitive. And as I noted a moment ago, I think the Biden administration should borrow whatever political capital it has for school reform to actually augment its efforts around a range of non-school focused activities that have a potential to accomplish more. I'm thinking about things like the fiscal relief package, but things involve not just funding for families directly, but fighting for a child tax credit, ideally something that would a permanent credit rather than temporary, which is what's being discussed now. I think these kinds of things addressed to families and children that will reduce childhood poverty will probably have a longer term effect on education and life chances of kids than would what we traditionally think of as the education levers. I'm not hearing.
Thank you, Professor Henning. What I want to do is use that and pivot to a question for Professor Kagan. As you mentioned children, as you mentioned young people, what are going to be the major issues facing American early childhood education, and how does the Biden plan address these issues?
Thanks so much, Basil, and thanks, Jeff. That was really a good kind of setup and segue into the things that are on the mind of many early childhood educators in our country and actually throughout the world. Basil, if you'd asked me that question 5 years ago, I would have said, we've got to make folks understand the importance of the early years. And so that would have been the primary issue. Right now, I think if you ask Americans, and there was a poll where 75% of Americans were asked what they thought about early childhood, and 75% said they really saw it as a national priority. So that coming of age has really happened. Having said that, though, there are three big issues that I'd like to discuss. The first is quality, and the second one is equity, and the third one is coordination. Let me tell you what the issue is, what Biden is proposing to do about it, and then where I would hope we would actually go even further. So first of all, with regard to quality, many people who don't know early childhood don't realize that of the centers and programs that exist for young children, only 40% of them meet any kind of a quality benchmark. That's really a problem when you think about it. We're relying on early childhood to do a heavy lift for society. And when we don't have a lot of quality in those programs, we've got a problem. So Biden-Harris really recognize this. They're allocating about $30 billion, that's with a B, and that is about double the amount of money that we have invested in all early childhood right now. So they've made a big, big financial commitment. And on the quality issue, I think they're doing a good job. They're talking about adjusting ratios, making sure that we have teachers who are decently compensated. Many of you might be aware that early childhood teachers make about $25,000 to $30,000 a year. They're severely, severely underpaid for the important work they do. But there's some important things that it does not do, and it does not support actually the kind of infrastructure that Jeff was talking about, a sustained effort at data collection with the goal of continuous improvement, looking very, very hard at the regulatory apparatus to make sure that we ensure quality over time. From my work internationally, I will say to you that we could use some sort of a national quality framework. All other advanced societies have it. America doesn't. And even in societies that have highly decentralized approaches like Australia to education, they all have national curricula, national approaches for very, very young children, a framework. The second issue is the equity issue, and this is perhaps amongst the more troublesome ones. About 52% of all children in America live in what would be considered a childcare or early education desert. That means that there just are simply not programs for them. And even if there were programs for them, poor people have far, far more inhibited access to programs than wealthy programs do, because many, many programs are actually in the private sector and people can pay their way into them. This has been a problem. This equity issue has been a problem for many, many, many years. It's been exacerbated by COVID. We have had about 21% of centers in poor communities actually close. And we have all child care centers saying that they are facing really important financial problems. Biden-Harris has done a good job. They're putting $15 billion into this, into the equity side of the equation. And of course, as we will talk about, the child care tax credit of $3,600 per child will go a very, very long way. I think we're probably going to all be in unison about this. So I would say they're doing a pretty good job. I'm concerned that we're not prioritizing infants and toddlers, and that there's very little in here that would incentivize promoting a workforce that looks like the children it serves. This is not an equitable workforce at all. Third issue, biggest one of all, is coordination. Many of you may be aware that early childhood exists on the back of 72 different funding streams and different programs. And each of those have their own policies, their own regulations, their own guidances, their own eligibility requirements. And so people who have to coordinate this are program directors. And that would be okay if a program director, like a school principal, had an infrastructure of supports beneath him or her. When you think about it, school principals rely on boards of education. They have consolidated administration. They have somebody they don't have to worry about necessarily all of their busing, their accountability measures. In early childhood, every little program director, every mom and pop on the corner has to figure that out for themselves and how to blend these fundings across these myriad funding streams. I would have to say here that Biden-Harris does very, very, very little on attacking this fundamental problem. It is why my colleague Caitlin Dermody and I called for an op-ed article in the Post recently, the establishment of a White House Office for Children. We really feel there needs to be some entity at a very high and very visible level that makes quality, equity, and coordination the priority, and that will stand as a way to integrate services across administrations, the kinds of things that Jeff was talking about, and that will serve as a model indeed for states. So I guess my bottom line is, I think the Biden administration gets sort of an A+ on getting money into the system. But we all know that that's not the only issue. It's how that money is really used. And I would say there's a lot of room for growth on deploying that money so that we generate a system that is coordinated, that is of quality, that is equitably accessible, and that actually is sustainable and efficient. Those would be my wishes for early childhood.
Thank you, Professor Kagan. I actually want to piggyback on something you said when one of your first comments about what you might have said now relative to something you would have said 5 years ago, because Professor Scott Clayton, we seem to be having a much more intense and maybe even realistic conversation about student loan forgiveness now that we've had in some time. I know that you've weighed in on this issue many times publicly. $10,000 in loan forgiveness seems like a number that the Biden administration is comfortable with. A lot of progressives have been pushing close to 50 or 50,000. What is the economic benefit for loan forgiveness? Who does it benefit the most, and how close are we to a solution here?
Right. Well, I think first of all, just as you just said, the conversation has moved so much from where it was 5 years ago, where really right now what we're talking about is what's the number and how do we get it done, as opposed to is this something that should happen at all. And certainly, people will come down on a spectrum about what is the right number. But I would like to emphasize, I think $10,000 is not going to wipe out everything, but it absolutely could do a lot of good. And that's because of where the most urgent and most critical problems with student loan debt repayment right now, it's default rates. So when a student defaults on their student loan, that can have long-term financial consequences that can carry with them for the rest of their life. It can not only the financial consequences in terms of future opportunities to buy a car or to buy a home, but also potentially can interfere with your ability to rent an apartment, to get a license for your occupation in some states. And it also can affect your ability to re-enroll in college to continue your education. So when I think about student loan debt and the problems with student loan debt, I'm not so much focused on, how much are borrowers borrowing on average? Because a lot of borrowers actually borrow what look like big numbers, but are able to manage that because of the economic opportunities provided by their education. On the other hand, borrowers with less than $10,000, even sometimes less than $5,000, face the highest default rates. So default rates are highest among students who have the relatively smaller amounts of debt, often because they dropped out before finishing a degree. If we look at default rates before the pandemic, to give a sense of how big this issue was even before the pandemic, more than 1 in 4 student loan borrowers was experiencing a loan default, kind of the worst possible outcome of borrowing within 12 years of starting college, more than 1 in 4. So it's not like an unusual thing to happen. And for Black borrowers, that number is almost half. So really tragic consequences, huge implications for racial disparities. And with African-American borrowers, I want to emphasize it's also this is not just an issue of students not finishing their degrees. We see that Black students who earn a bachelor's degree actually have higher default rates than white dropouts. And that has to do with labor market discrimination and lots of other factors. that again just has helped change the conversation around student loan debt forgiveness. So that was all prior to the pandemic. So now in the pandemic, what is going on? Right now we have a freeze on student loan repayments, which is absolutely essential and I think reflects the understanding that if we didn't do something right now, it would really be the potential for devastation in terms of default rates just skyrocketing. So under the Trump administration, student loan payments frozen. The Biden administration has continued that. But it also sets up a situation now where the loan cancellation question is really even more urgent, because how do you get out of the situation that we're in right now without some kind of off-ramp to get people back into a better position? So that's where student loan cancellation could come in. By forgiving something like $10,000, $20,000, you could wipe out a lot of the borrowers who are at the greatest risk of default. That's still going to leave a lot of people with debt going forward. So where I would like to see the conversation shift now is away from what's the number, what's the right number. Let's pick a number and start talking about all the other things that are going to need to go along with that, as far as, does this cover undergraduate debt only, or where does graduate debt fit in? And most importantly of all, in my opinion, what are we going to do with borrowers who still have debt after this forgiveness goes into place? And my recommendation there would be to ensure that all borrowers are taking advantage of income-driven repayment plans, which protect them against default. Research has shown these plans, borrowers like them if they can get into them and stay into them. It's a little complicated to navigate that process. So let's make sure that students are able to take advantage of those plans, which can give borrowers as low as a $0 payment if their income is low enough for them to qualify. And then the second thing is, what do we do? You know, if we can get this figured out, we can move on to the conversation of higher education finance and all of these other things, so that we're not in exactly the same position, you know, because people are taking out loans today, they're going to be taking out loans 6 months from now. How do we prevent getting right back into the same situation again?
No, thank you very much, Professor. Does anyone in our audience have any questions that you'd like for me to pose to the panel today? So, question from Harriet Jackson. This is to Professor Kagan. Which countries with a national curriculum, centralized or not, are most promising models for early childhood education in the US? Are Finland and France still considered models?
It's a terrific question, and is one that I teach an entire course on. So forgive me for having to truncate my responses, but countries vary dramatically in their socio-political contexts and also in their historical context, their values. And that leads indeed to the amount of money and the way they invest in young children. Right now, I would say that every country with whom we compete has some piece of early childhood service that we indeed do not have. Most of them provide far better services across the board, like what Jeff was talking about, beginning at prenatal care, caring through screening, parenting, and home visitation. So when we talk about early childhood, we're really talking about birth to age 8. So it's a broad swath. Finland stands very, very tall, as it always has, largely because it is a social welfare state. France indeed does a wonderful job, but actually the Asian countries are finding very inventive ways to finance early childhood that we could learn a lot from. England's system of monitoring and of inspection is something that we could learn from. So my response would be, there's no perfect system. Each is perfect for its own context, and America's got a long way to go. We could take from all of them and do a heck of a lot better job than we're doing.
All right. Thank you, Professor Kagan. Any other questions? If there are no others, I want to thank our panel, Professor Henning, Professor Kagan, and Professor Scott Clayton. Thank you so much for your insights, and we'll be following and seeing what happens with this administration. Thank you all very much.
Thank you, Basil.
Thank you.
Thank you.
Thank you. I want to now bring up our next panel, which is focused on public health policy. Starting us off is Professor John Allegrante. He's the Professor of Health Education here at Teachers College. So, Professor, it's good to see you. Good afternoon. Professor Pamela Cook, Research Associate Professor for the program in nutrition and executive director of the Laurie M. Tisch Center for Food Education and Policy at Teachers College. Good to see you. Professor Kim Noble, a professor of neuroscience and education at Teachers College, and Professor Sonali Rajan, associate professor of health education at Teachers College. Welcome, all of you. Good afternoon. And let's get right into it. If I can start with you, Professor Alagrante. And I hope I'm saying that correctly. Forgive me.
You are.
It's wonderful. Now, President Joe Biden spoke often about empathy during his campaign. And in one of his first acts as president, he's upped vaccine distribution. And I have to say, my parents both got a vaccine, and I think I congratulated them, which is just odd to say in an environment. Congratulations on a vaccine. But there are still challenges, clearly. What lessons has this vaccine rollout taught us about our public health infrastructure? What changes do you think should be made? And just broadly, how do we restore the role of government, confidence in the role of government to promote the greatest good?
Well, thanks very much, Basil. It's a pleasure to be with you and these distinguished colleagues of mine. And I really appreciate the phrasing of your question. It does remind me a little bit of Jeremy Bentham, the 18th century English philosopher, whose belief was that the greatest happiness of the greatest numbers should really be guiding us in policy, which is certainly relevant here. That said, my focus is clearly on population health. And I think there are several things that President Biden can do in building on the vaccines rollout to both improve population health and restore public confidence generally. And I'm going to talk about three challenges, if you will, all from 30,000 feet. COVID-19, of course, going forward. I want to talk about infrastructure. And I want to talk about climate change because they're all relevant here and they're all related. First of all, the coronavirus pandemic has already cost the nation, over 500,000 American lives. Many of these deaths were excessive. They could have been prevented. And this has, as you probably know, resulted in a loss of almost 1 full year of life expectancy overall, and 3 years for the Black community. Thus, the pandemic has, I think, amplified the already existing health disparities in access and treatment and in outcomes that have really separated white from Black America and other communities of color for decades. And it is Black History Month, and I will say that Columbia doctors, Colin McCord and Harold Freeman were the first to document this problem of disparities among Blacks in Harlem 30 years ago. So it's an important issue, and it's been exacerbated entirely by COVID-19. But perhaps most importantly with respect to this, the pandemic, I think, has really revealed the deficiencies, the limitations of a public health infrastructure in this country that has been long degraded for almost 4 decades now, going back to the Reagan administration and the beginning of what I would say was the deregulatory policy environment that started with the Reagan years. So we are, I think, at a critical inflection point, a reckoning, if you will, with our future because of COVID-19. So much of the Biden presidency, I think, will have to focus on getting the COVID-19 pandemic under control in the short term and laying the foundation for preventing the spread of COVID-19 and frankly, other viruses to come in the long term. I think in the short term, that's going to require that we be prepared for the variants or the mutations of COVID-19 that we're beginning to see, and really the possibility of a 4th wave in the spring. I think it's going to mean reinforcing the continued use of masks, social distancing, and the attention to hand hygiene and not gathering in large groups. I just got vaccinated. I'm not planning anytime soon to be in large groups or to be going to restaurants. And I think it also means, to build on the previous panel's interests, safely opening our schools for in-person instruction where that is possible. And that will mean prioritizing teachers for vaccination. I think that's going to have to be done because I think we're already seeing evidence of severe impacts in terms of mental health on young people who are not in school. In the longer term, I think the focus really does need to be on ensuring that we lead in getting the rest of the world vaccinated. We cannot, as a nation, fall into a trap of vaccine nationalism or a vaccine isolationism. It's in our national interest to ensure that the rest of the world has access to effective vaccines. And I think rejoining the World Health Organization and reasserting our leadership nation status in the world, which the Biden-Harris ticket has done, is a very important first step. So I think those are all things related to COVID-19. Infrastructure. We all remember the failure of the pumps in New Orleans in 2005. We all remember that bridge that collapsed in Minneapolis in 2007. And now I think we will all remember what happened in Texas with respect to the electric grid and the power failure. All of those catastrophic failures in infrastructure all demonstrate just how much human population health is related to our infrastructure, and how these failures of infrastructure really do result in public health catastrophes and human misery that have just tremendous impact on the nation and on the population. So, my hope is that the administration will take a very long view here, that it will work to foster the political will so that we can get appropriations and make investments, not only in the physical infrastructure that's about rebuilding our bridges, our rail system, our nationwide broadband capacity, our 5G technology, and reliable energy sources. I think it's also going to have to be about strengthening the public health workforce, strengthening the pandemic behavioral and social science, including health education, including health communication, that will be required for us to be better prepared for the next pandemic, which, as I say, will come at some point. And finally, I want to end and talk just briefly about climate change. It's actually related to what I just said about infrastructure. I think there's little, if any, serious scientific doubt that climate and environmental change represent an existential threat. That means President Biden has to really focus the nation's interest on addressing climate change. We're simply out of time at this point. The planet is already experiencing the global impact of climate change, and we are now seeing the health consequences of climate and environmental change on a regular basis. And in addition to what we have just seen in Texas, climate change means increasing infections. It means increasing respiratory disease. It means increasing malnutrition, along with other problems and conditions, all of which have especially profound consequences for people of color and vulnerable populations. So these would be my priorities going forward for Biden-Harris. But let me just quickly say, to close out, all of these priorities, I think, will require, achieving them will require a much larger national conversation about democracy and its contours, about our conceptions of government, and about the extent to which, as Americans, we are really prepared to revisit what we could call the enduring dilemma of our democracy. And that is how to achieve a better balance between private right and our sort of sense of unfettered freedom to do whatever we want. We saw that with mask wearing. How do we balance private right with public good, which brings us right back to Bentham. So without that, I'm somewhat pessimistic on the question of whether we can achieve any of the big ideas, the big projects that I think are going to be necessary to really put the country back on the kind of footing that we were once, perhaps 40 or 50 years ago, going forward. So thanks very much.
Thank you, Professor. I have to just use a moderator's prerogative for just a second. Your words were, hit home. I lost 12 people that I knew to COVID. actually, in a relatively short period of time. And the church that I grew up in the Bronx, St. Luke Episcopal Church, 21 members of that church passed away because of COVID, and about the same amount of time. So it is sobering, both the inequities, the effect on community, and the mental health aspects of such loss in such a short period of time that I know so many others have experienced, and even worse than I have and my family has. So thank you for raising those issues and talking and speaking about public health as well, mental health as well. Thank you very much. Professor Cook, I want to turn to you because we did, Professor Allegrante did talk about disparities, and I want to talk about the 2010 Healthy Hunger Free Kids Act. That act in 2010, it was championed by Michelle and Barack Obama, but 2010 was the last time that act was reauthorized. I'll say it again: the Healthy Hunger Free Kids Act from 2010, last time it was reauthorized. What should be the priorities for the next Child Nutrition Act, and how can that act and maybe other programs and policies help New York City and cities like New York, which you've described as facing a, quote, food apartheid? Professor, you're on mute. Oh, the professor has logged off. I imagine that she will come back on shortly. So maybe in that period of time, I can address the next question to Professor Noble. She's professor of neuroscience and education at Teachers College. So Professor Noble, if I could just pose this question to you. There is bipartisan discussion in DC of a child allowance, and we heard about early childhood education before. What about unconditional cash transfers? They sound attractive. How could they work, and how could they be effective? Professor Cook, I just moved on to Professor Noble. We'll come back. But Professor Noble, cash transfers.
Sure. Thank you, Basil. Yes,
Sure.
Thank you. And also let me express my heartfelt condolences. Thank you for sharing your personal story. And I know I speak on behalf of the whole panel that we're very, very sorry to hear
Thank you.
Your tremendous loss. So on the subject of unconditional cash transfers, well, we know that there's longstanding evidence that growing up in poverty puts kids at risk for a host of detrimental outcomes, everything ranging from school achievement to physical and mental health to well-being across the lifespan, time spent in the labor force, and even brain development. And as a neuroscientist, I can say that the evidence suggests that those brain differences that we see are neither innate nor immutable, meaning that we don't see poverty-related brain differences at birth, and we believe that the poverty-related brain differences that we do see later on can be changed with intervention. Now, unconditional cash transfers represent money that's given to individuals that can be spent however those individuals would like. So really no strings attached. And that contrasts to conditional cash transfers, which is money that is conditioned on certain behaviors, like making sure your kids go to school or get vaccinated. So in many ways, unconditional cash transfers, or giving people money without strings, really represents the most straightforward anti-poverty policy. Now, currently, the child tax credit essentially functions as an unconditional cash transfer in the sense that it can be spent without restrictions. No one checks how you or I spend our child tax credit. But ironically, the child tax credit, as it's formulated now, isn't seen by our poorest citizens because they don't earn enough money to benefit from it. And so importantly, the Biden-Harris plan is to take that child tax credit and make it fully refundable. And that amounts to coming to an extra $3,600 a year for all children under the age of 6, and an extra $3,000 a year for all children between the ages of 6 and 17. And as you mentioned, there is bipartisan support for this kind of cash transfer. So Mitt Romney has a very similar plan, suggesting that perhaps for the first time in history, we are seeing bipartisan support for this kind of unconditional cash transfer in the form of a child allowance. Now, I'll note that it will be very important to continue this support beyond the currently proposed 1 year. I would say that by providing this kind of unconditional monetary support to families, a child allowance really allows families to provide flexibility in the ways that they invest in their children, in ways that meet the particular family's goals. So it really serves to empower families to make the decisions that are best for their children and for themselves.
Professor Noble, thank you so very much. We're going to go back to Professor Cook. Let me just rephrase the question for you. 2010 was the last time the Healthy Hunger Free Kids Act, championed by both Michelle and Barack Obama, was reauthorized. What should the priorities be for the next Child Nutrition Act, and how can that help cities like New York, which you've described as facing a food apartheid? Professor Cook.
Sure, and you can hear me now, right? I want to start out, and before I get to your question, just highlight something that Professor Allegrante said, which is about climate change. And I have been working closely with colleagues at the new climate school at Columbia on food for humanity. And we are going to be in a really desperate situation, not to produce enough calories, but to produce enough nourishing food in a way that sustains our planet, that's going to affect every public health and every education problem. So I think we need to make sure we're focusing on that. So on the Healthy Hunger Free Kids Act, which is school meals as well as a lot of other child nutrition policies, I want to say that you probably all remember back at the beginning of the COVID pandemic that we all realized the importance of school meals for food security for children, but also because there's schools in every single community across the country, and they were already making meals. So they rose up and actually produced food for children and adults. That was really, really important. And I hope that that will last on to raise our respect for the school meals program. So we actually, child nutrition usually is reauthorized every 5 years. It's now been over 10 years. And that's because when they tried to do it last time, basically there was a lot of dysfunction in the government. We actually have a TC alumni, Allie Hard, who works for Bobby Scott, who's the chair of the Committee on Education and Labor in the House of Representatives. And she's going to be key in writing the bill. So we have a great TC in. So here are 4 recommendations that I have for the next nutrition bill. First, restoring the nutrition standards that were rolled back by our previous presidential administration that really made the meals more nutritious, because most schools were already meeting those standards before they were rolled back. It was actually a political reason for rolling them back. Second is to increase the reimbursement. That's how much schools get for each meal that they serve, because there is more money needed if we want schools to be proud of the meals that are served, that they are healthy and the high quality food that we want to be giving our children as they are making it through the school day. Third is to increase funding for grants for schools for kitchen infrastructure improvements. Schools want to do more scratch cooking. There was a big pilot of scratch cooking in New York City. There are school districts around the country that want to cook and have meals that they can be proud of serving. And yet the budget for kitchen infrastructure started to get cut in the 80s by the Reagan administration and has never been restored. So we need a big boost in that if we want to make the meals that we want for our children. And fourth is to increase funding to 2 programs that get a very small amount of funding now. That's Teen Nutrition and Farm to School, which help to educate children about food and nutrition. And it's essential for children to get great education through gardening, cooking, learning about food justice in order for them to actually then be excited about healthy food in school meals as well as healthy food outside of the school meals. Now I want to get to the second part of your question that relates to what we can do in New York City and food apartheid. And first, I want to raise up 2 leaders in food system justice who have transitioned us in the food world from thinking in terms of food deserts to food apartheid, which I think is a much better term. Those 2 leaders are farmers and activists, Karen Washington from Rise and Root Farm and Leah Penniman from Soulfire Farm. So I want to thank them for all of the work that they've done. So what is food apartheid? What does it mean? It is thinking about who eats and what they eat and why they end up being able to eat that through the lens of income, race, and geography. It lifts up the social and racial inequities to make it clear that it is long-term systemic issues that limit access to healthy, fresh food in some communities. And that these issues have often been created by and supported through public policies in the past. So we need to change those public policies now into the future. The COVID-19 pandemic has brought the issue of food apartheid to the forefront. One of the reasons why low-income and people of color, which we've already talked about on this panel, are more susceptible to COVID, more likely to have severe cases, and more likely to die from COVID is directly related to access to food. When people have food that is calorie rich, yet nutrient poor, which is actually the majority of food, 60% of food in supermarkets right now, it is not just a risk factor for chronic diseases like type 2 diabetes and high blood pressure and heart disease. It is also a risk factor for infectious diseases such as COVID. The reality is food security and limited access to health promoting food has major health and education, because children cannot learn when they are not food secure and also are not getting the right nutrition. So it has major health and education consequences. And we need not to see this as a failure of individuals, but rather a failure of systems that need to be fixed. So in New York City, we have some good news. Just this week, on February 23rd, a few days ago, New York City released its first ever 10-year food policy plan that's called Food Forward NYC. Kate McKenzie, who is the director of food policy in the New York City's mayor office, and also a Teachers College alum, led this work. This plan shows that we have to think about how food workers from farms to school food employees are essential, and that every single New Yorker in every community needs multiple ways to access healthy, affordable, and culturally appropriate food each and every day. To get there, we need systems and knowledge to transform every aspect of food, from how we grow our food on farms, to thinking about how much it's processed, to thinking about the resources used in food packaging, to thinking about the pricing structures to make food that keeps us healthy, such as locally grown fruits and vegetables, whole grains, beans, and nuts, the most available and the most affordable foods in every community. So what can our next mayor of New York City do, since we have a mayoral election this year, is they can realize that this food policy plan exists, and a lot went into it, and there was a lot of community-based input into this plan. So that plan is Food Forward New York City. And the next mayor, I hope, will raise awareness about this plan and provide all of the resources that are needed to fully implement this plan. Often it's creating the plan that's the hardest part, and we have that. So we want to fully implement it. And to do that, we are also going to have to work along with New York state government and the federal government so we can transform the food system and everyone can eat well, which will help with all the public health problems that we've been talking about. Thank you.
No, thank you, Professor Cook, and thank you for a public service announcement and reminder that we do have a mayoral election in New York City this year, and June 22nd is the primary where most of the action will be had, and that June 22nd primary and then the general in November. I think it's November 2nd. I should actually know that. Thank you so much, Professor Cook. And Professor Rajan, I want to turn to you because in this sort of final segment in our panel, we've been reflecting a lot, I think, as a country about who we are as a democracy, clearly. We all saw the insurrection on January 6th at our nation's capital. New York City and other parts of the country may be seeing a surge in crime, particularly gun violence. So we're used to speaking a lot about the latter, but now we're focused as a country on white supremacy, white supremacists, particularly as they use the digital space. How should schools respond? And what are the challenges of talking to young people, to kids, about this moment in time?
Thank you so much. So that's a fabulous question with a lot of parts. I'm going to try and break it down a little bit. And thank you again for inviting me to be a part of this today with all of you. So I think it's so interesting. At the beginning, you said we've been talking about, we're used to talking about gun violence, and we are used to talking about it. We are not used to actually doing anything about it. And that's actually been the problem. So gun violence just in and of itself is a decades-long endemic here in the United States. So that means it's not an emerging threat. It's been a persistent public health threat now for years. And about 40,000 Americans die every year by firearms. About another 60,000 are injured by firearms. This doesn't account for the thousands and thousands of kids, adults, schools, communities who are impacted by gun violence in other ways. They've witnessed gunfire, they're hearing gunshots, they have a friend or a loved one who's been shot or killed. So the scope of this problem and the magnitude of this problem here in the United States is just so overwhelming. And so this has to be a priority for the Biden administration to address, because there are thousands of individuals who are impacted every single day by this public health crisis. Gun violence in K through 12 schools in particular also persists. So there's an interesting data point: about 240,000 students have experienced some form of gun violence since the Columbine shooting in 1999. That is a problem, and we have ways to fix it. We just need some political capital and will and resources in order to do so. The other problem, and my colleagues here have talked about the intersection of other public health crises with the COVID pandemic, gun violence increased during COVID here in New York, as well as in other parts of the country. And as you were just mentioning, we saw the insurrection on January 6th, which is another form of mass violence, occur earlier this year. So collectively, these are traumatic events that are without a doubt impacting the health and the well-being of our communities, and certainly the health and well-being of children. Most likely, children who already have a history of some sort of trauma are also being disproportionately impacted by these kinds of events. And there is a very clear intersection between racism and trauma and gun violence and other forms of adverse childhood experiences. So we see the coming together of a lot of public health crises that, again, need to be addressed. So the way I think about it is that there are ways, certainly I think of K through 12 schools as an opportunity to intervene and support and provide resources for kids, because kids spend a lot of time in school. So it's a great place for support, for interventions, but we need to invest in our public schools in a very real way and through evidence-informed strategies. So just for some examples here, just to share with the audience, we should really be, first of all, thinking about prevention of violence well before someone, let's say, chooses to bring a gun to school. Right now, a lot of schools are implementing what we would call very reactive strategies. So what do you do in the moment of a shooting? But prevention, as my colleagues on the panel today know more than anyone, prevention occurs. There's a whole spectrum, right? Well before an act of violence occurs. Prevention can occur very early on. So we could eradicate school policies that encourage over-policing. We should be advocating for policies at the state level, at the federal level, that would make it fundamentally more difficult for children to access guns. We should replace punitive disciplinary strategies with trauma-informed practices. We should support programs, really invest in support programs that address the needs of the whole child. We should invest in efforts that cultivate inclusive school climate. We should increase the capacity of mental health professionals to serve youth in school settings, and then also connect them to community-based resources where it's needed. These are just a handful of examples that have some sort of evidence informing their effectiveness. And all of these kinds of efforts would not only likely reduce the onset of gun violence, but would likely result in other more positive health and learning outcomes across the board. And so we would have a school climate, and by extension, a community climate in which we could better support kids and teachers and their families in the aftermath of traumatic events like the one we saw on January 6th. Schools have the potential to be transformative spaces, and we heard a little bit about our colleagues in the previous panel discuss this a little bit, but we should be thinking about the potential of these spaces accordingly. President Biden, in my opinion, really could use this opportunity to think about gun violence prevention, first of all, as the public health crisis it is, but also to think creatively, to think out of the box, to think about gun violence prevention, not just about gun safety or reducing access to firearms, although that is certainly part of the solution, but thinking about the solution in this much broader preventive sense of terms. He also could, and this is something we've seen a little bit of increase in, and I think this is really encouraging, but we should also continue to increase federal funding and other resources that could go towards the scientific study of gun violence prevention. So we have the resources and the science behind us to continue informing evidence-informed solution. And then lastly, in terms of just talking to kids, there's a whole set of resources, the Department of Education, PBS, other organizations such as Facing History and ourselves, who have put together some really excellent resources about trauma-informed tips and ways in which to support not just children, but also teachers themselves as they help students cope in the aftermath of these kinds of events. And this is challenging. And the good news is we have resources that exist, but I would say right now the primary focus really should be on how do we implement efforts to engage in true prevention. So let's stop these events, these kinds of violent incidents well before they even occur.
Professor, thank you so very much. That hit home because when I was 12 years old, I was shot by a 14-year-old outside of the school. And all of the work that you're doing affects people's lives, whether they're young or whether they're adults. So thank you all for the work that you do. We have time for, I think, 1 or 2 questions from the audience. First is from Jane Lee. Jane is in Dr. Noble's class, and she's excited to see you here, Dr. Noble. Her question regarding policies is, why do we even need research findings to make a point that children shouldn't have to go through poverty? That is to Professor Noble.
Thank you, Jane, for the question. So certainly from a social justice perspective, we can agree that child poverty should be eradicated. That said, I do think a priority does need to be on research because there are lots of potential different avenues toward doing that, right? If we think about child experience having cascading effects on children's and families' experiences, which in turn have cascading effects on child development, we can imagine intervening anywhere along that pathway. Right? So you can imagine intervening at the level of child development itself, commonly through school-based interventions. You can imagine intervening at the level of numerous different experiences, right? We've heard of a number of different examples of experience-based interventions today, whether it's food and nutritional support or anti-gun violence or a host of others. And you can also imagine intervening at the most distal level by trying to eradicate poverty itself. And clearly all are going to be important spokes in that wheel to try to promote justice for children and the ability for all children to live up to their developmental potential.
All right. Maybe one last question we can take. This is from Sean Stokes for Dr. Alagrante and other panelists. Considering the pandemic, how can the Biden-Harris administration encourage more people to become teachers? Will people be less likely to join the field? This question is posed to all of you, so we'll do a lightning round of answers. We'll start with you, Professor Alagrante, and then we'll go around.
Thank you very much for the question. I view it as both. I view it as insightful with both an S and a C. I think we do need to build our teacher corps, and I think we've got Jill Biden in the White House, and I think she's going to be a terrific role model for a lot of young men and women who may aspire to education.
Professor Cook, any thoughts?
Sure. I think that what's going to happen, and maybe this is being optimistic, but I think what's going to happen from this pandemic is people are going to think about what really matters in the world. And I believe people become teachers because they want to help the next generation. So I think despite the challenges of the pandemic, we are going to have more people wanting to become teachers. And I agree, Joe Biden will help out with that tremendously.
Professor Rajan.
Honestly, pay teachers better. Pay all teachers, public school teachers, better. Support them. Don't put them in classes where we have huge student-to-teacher ratios. Support teachers for the work that they do. It's unbelievable how we don't value the work given what they do for our children. So that, to me, that's something that the federal government can and should prioritize absolutely right now.
And Professor Noble, you'll close us out.
Sure. So building off of what Dr. Rajan said, as well as something that Professor Kagan said earlier, not only providing fair and equitable compensation to K-12 teachers, but also to early childhood teachers who we know are grossly undercompensated relative to the critically important role they play in shaping early childhood development.
Well, I want to thank all of you for a great panel discussion, a distinguished panel indeed. For the panelists in our earlier discussion on education policy, early childhood, K-12 and higher ed, and this one on public health policy. Thank you so very much for all those that joined us for the Coming Together series addressing the agenda, education, and public health in the new administration. It's been a wonderful discussion thus far. We look forward to more such series, and thank you, the audience, for joining us today and participating. Thanks again.